This is ASAP Pathway. Hey, everybody. Welcome back. Welcome back, listener. I'm glad you're tuning in again. Hopefully, today we can share some information, learn together, have a good time, and I'm really excited. I always say this, and I am. I love doing these podcasts because I get to talk to people that ordinarily I don't get to talk to on a regular basis, get caught up and get to know people. And today is no exception. One of our ASAP members extraordinaire, Dr. Euna Koo, is here with us today. Welcome.
Thank you.
I really, we were talking before we started recording, and I kept saying, okay, we have to stop because this is pretty much the podcast. So we got to get on there because there's just so much to say. And I'm just so impressed with your journey. I feel so many people out there need to hear what you have done, how you're a leader in your community, what you've done to help your own children, what you're doing to help other children, collaboration. There's just so much we need to dive into. So I would love to introduce you, if that's okay with you, to our listener. And then we can just jump in and let's start having some much needed conversation today. Dr. Koo is a mom, wife, and dentist in that order because people come first. That people first philosophy shapes everything she does and translates to a deeper, more personal level of care for her patients. She looks beyond teeth, considering how the mouth functions today and how it will influence the overall health and wellness in the future. Breathe Cincinnati is the culmination of her expertise as a dentist and her collaboration with other healthcare professionals. It's a space designed to explore and support the ripple effects of the mouth throughout the entire body. Her children and her own sleep journey inspired the creation of Breathe Cincinnati. She is a patient, the parent, and the practitioner. She wants every patient to receive the same thoughtful, individualized care she sought for her own family, only without having to fight so hard to find it. We're going to get into that. Breathe Cincinnati's mission is to forge a path that recognizes the mouth's vital role in supporting breath, sleep, and wellness, to create a better world through better sleep for each person and for the benefit of all. With that, let's dive in. Let's dive in. I think I kind of almost want to, I had an idea of how I wanted to lay it out, introduce you to the audience and then go into, your journey, which we will do. But I can't help but just stop for a second. When you said in your bio, I want to provide other people with the same thoughtful, individualized care that I provided for my own family, only without having to fight so hard to find it. When I read that, I mean, it hit me and I could feel it in my chest as a mom and as a practitioner. I'm going to try not to get emotional, but that line is so important because that is what's happening right now. We have a lot of people, a lot of parents, you and I discussed this, that come to us. They are desperate. They want answers. They're getting information from social media and they are fighting for their kids and they don't know where to go. So that is the same thing that drove you. It drove me. It's driven a lot of practitioners that are doing this. So thank you for sharing that so eloquently. Like it's so well said. I would love for you to share your story. I would love for you to talk about, you're a primary care general dentist. You're a diplomate with the American Board of Dental Sleep Medicine. Did you do that first? Were you doing adult airway within your general practice? Were you doing any advancement? No. Okay. So tell us about your journey and like how did you get involved and as a diplomate as well? Because we're going to dive into that too.
Yeah, sure. So my background, just growing up, um, you forget a lot as you grow up, and then you start to take some courses or you have a child and your child reminds you of yourself. I had a wonderful partner, Dr. Michael Rolfus, who, when my kids were super little, he would come back and he would ask me, "Hey, um, does Sydney sleep with her mouth open or closed?" And I was like, "Closed." And he's like, "Yeah, yeah, I've heard that's like a big deal. Like you're really supposed to keep your mouth closed." And I thought, okay. And then he came back another time, asked me where my tongue was, and I said, "At the roof of my mouth." And he goes, "Really?" And I said, "Yeah, where's yours?"
Where's your tongue?
Yeah,
Yeah.
where's yours? And he's like, "Well, the tip of my tongue is up, but the bottom part is kind of low." And I thought, huh. And then I got up from my office and I walked down the hallway to see my patient. And I thought, oh, wait, that's where mine is. It is just the tip, not the whole thing. So after I finished my procedure, I went back and I said, well, where is it supposed to be? And he's like, apparently the whole thing is supposed to be resting against the top of your mouth. And I thought, oh, that's not what mine does. Um, so in 2021, after the pandemic had kind of died down, I'd heard a lot about Jeff Rouse's course. And so I went out there, and I told him at the very end, can I get a photo with you? This is a life point because that is me. That's my story. And I know that's my kid too. Um, then I came home, I took the CT scan, the CBCT, and then I looked at it and it was non-existent. My airway was non-existent. Then I did my husband and his was massive. And my husband is a physician and he said, "Oh, so that's why you're always tired and that's why you can't sleep. Maybe you should fix that." And I said, "Yeah, okay." Then I sleep tested my kids. I had my oldest, I was told she was a colicky baby.
Hmm.
I took her to five different practitioners. They all said she didn't have a tongue tie. And I said, yes, I know the definition. I know she can stick her tongue out past her lower lip. So if she has nothing wrong, then it's me. And okay. So I struggled for 4 months. And then a friend had to say, you've done everything that you can. I think it's okay to like let go of that part of your journey. So I pumped for a year, but then when I was at the course, now I'm on to my third kid. My second child was completely different. She didn't have to be sleep trained. She always woke up happy, where my oldest had really large emotional outbursts. So we sleep screened her, I should say, and it was an exact correlation. When she woke up happy, she had a great night of sleep. When she woke up grumpy at like 6, sounding like a 16-year-old, her sleep was awful. So my husband said, I don't care where you have to go or what you have to do, fix that. And I said, I'm on it. If I have the permission to go to all these courses, like I'm gonna do it. Um, it was the orthodontist that first mentioned that maybe Sydney should have her tonsils and adenoids out. And I thought,
How old was she at this age, at this
she was
time?
5.5.
5.5. Okay.
5.5. And I said, because I'm that mom, well, the pediatrician has never said anything. She's never been on antibiotics. She's never had strep throat and she's never had an ear infection. Why are you the first one to tell me this? And he said, well, here's some of the imaging. And I saw that it was restricted in both spots. I knew she had a low voice. I talked to my sister, who's an anesthesiologist, and she said, yeah, that sounds about right. And I'm like, why didn't you say anything to me? She was like, I don't know. I mean, and I said, but the pediatrician, she's like, well, they're not going to say anything unless something is wrong and she hasn't been sick. And I was like, okay. So it took me a year. I went to the children's hospital. Of course, I'm that mom. So I like went to the head of the department. I'm like, okay, I don't want to do this just because I'm a dentist and this seems to be what we're doing right now. I want to have like independent verification that I should do this. I walked in, he kind of scolded me for being there. Like, why are you here?
That's a
And
big
I
one.
was
Why
like,
are you here? I get
yeah.
that all the time, Muna.
Yeah, why are you here? And I'm like, well, does she snore? I'm like, no, she doesn't, but she breathes really heavy. Like I can always tell when she falls asleep. And he's like, well, the tonsils look fine. I don't know if you want to, we can get an x-ray for the adenoids. And I said, well, I have some imaging. And he said, well, no, I need what I need. And I said, okay, radiate my child again. All right. So we went out, we got the x-ray, came back in, and he said, I suppose you could get the adenoids out if you want. And I said, but what about the tonsils? He's like, no. I said, okay, well, I don't want to do this because I'm pushing it. I don't want to do a procedure because I'm pushing it. And then he was just kind of dismissive. So I left with my tail between my legs and I waited. And then I went to more courses. And then I heard different things and I thought, okay, I'm going to look for a different person. So I took her to a different person. And that person said, yes, I would take out her tonsils and adenoids.
And
But
this was another, you went to another
I
ENT.
went to another
Opinion.
ENT.
Is this your second ENT at this
This
point?
is the second ENT. And
Yeah.
she said yes. And I said,
Now, why did she seem, now looking back, when you walked in to the room with the second ENT, did you come in differently with this other ENT? Did you bring different information, different symptoms? Or do you feel like you walked in equally with the same information and one just seemed to know more about being more
yes,
progressive? Okay.
because she was sleep medicine board certified and pediatric ENT.
There you go.
But I cringe at it now because I was still that patient. And I said, well, I had a consultation with so and so. He didn't feel that it was necessary. And she said, I have full respect for that person. I'm looking at it from a different perspective.
Yeah.
You are telling me these are your concerns. And I feel that it would be in her best interest to move forward if you would like. And I said, okay, I have MD verification. Let's move forward. It was really difficult. But when I woke my daughter up at 2 in the morning to give her antibiotics and her medicine, she said, you're right, mommy. I do sleep better. And I was kind of like, oh, you're a people pleaser. You heard me talking. Like, what does that really mean? And she said, oh, there's not all this stuff in the back of my throat. And I was just like, oh my gosh. Like, so she's known.
So she articulated the difference she was feeling.
Yes.
Yeah.
And I was just like, wow. So that kind of gave me a lot of motivation because I thought if I were not a dentist right now, I would not know this. I would
Correct.
not have access. And before a practitioner, if you don't know, and a practitioner's like, this is what you do, here are the meds, da da, go for it. Before I commit my child to a lifetime of medications, because if once you have it, you don't just suddenly not have something. Like I would want someone to just share, hey, have you looked at this? Have you considered this? Maybe this is something worth looking at. But the degree that we get, it doesn't like give us like that we're so smart, but it gives us the understanding to be able to interpret that language, like that
Correct.
subset of language. And so that's kind of what started everything and really just went down really deep rabbit hole because I know the journey that I've had as a person and I don't want that for my kids. I think I identified definitely by the age of 18 once I had access to my own doctors at college where I could like schedule an appointment for myself. I told every practitioner, I'm really tired. And they would just dismiss me like, you're fine, you're healthy, you're just like, you have night hours or this. Then I went to or university for dental, and then I went again, and they were just like, well, you're a grad student. You're studying
Right.
really.
Right.
And I said, okay, then I just must be lazy. Like, honestly, I just, because everybody else looks like they have more energy than I do. So it must be me. And it's
And that
just,
affects your self-esteem,
yeah,
you know?
100%.
Imagine being a kid too, looking around and I mean, even at, 18, 19, 20, you're like, what the heck's wrong with me? But when you look at kids and they're just like, why can't I sit still? Why am I always in trouble? They're labeled. They get the
Yes,
label and then they just carry it with them in life. It's
yes.
hard.
It's so hard. And the kids, some of those kids, when you get a chance and you ask them questions differently, questions that they can understand, and give them the freedom to speak freely,
Will you give
like,
an example of that? Like how you would word something different with a child?
yeah. So I'll say, hey, do you play any sports? And they'll be like, yeah. I'm like, what sports do you play? Oh, I play soccer, I play basketball. Like when you're out there on the court or on the field, do you feel like you have as much energy as everyone else? Or do you have to come off because coach pulls you off because you're like huffing and puffing? And they'll be like, oh, and then a lot of times I'll ask them, hey, when you wake up in the morning, are you like good to go? Or are you kind of grumpy and it takes you a long time to like get going? And so, or one question that I think is crazy, dentists don't even ask the question. I say, hey, I know this is a really weird question, but when you smile, does it take a lot of work? Like, does it take a lot of effort? Do you have to go like this? And they nod yes. Or from you, restless leg syndrome, I'll be like, hey, do you kind of like always want to move your body? And then they look at you like, yes.
Yeah.
How did you
There's this
know?
look when you ask, like, do you feel like you can't get comfortable and you have to like wiggle around a lot and move your legs? Are you uncomfortable? And they'll go, yes. Like even adults and kids,
I
like,
mean, they
how
hone
did you
in and
know?
they're like eye to eye, like, oh my goodness,
Yeah.
I can't believe. And so, just learning how to ask the questions differently. And then what's interesting is that sometimes the kid wants to say the right answer.
Yes, they're pleasers. Children are
Yes, they
naturally
are totally
pleasers.
pleasers.
Yeah.
And then you see the mom on the side going, no.
Yes. The mom's like, no, no, that's not right.
Or like they're trying to hold back and they'll be like, I don't know, Charlie. You sure about that answer? And then like if Charlie will look back at me, but mom's like, true.
That's not true. Don't listen to Charlie.
Because they don't want to be wrong. They want to be like, they
Yeah.
want to be right. And they don't want to acknowledge some of those things. And I think the little things that my son has said as he's gone through his journey of what changes for him, and then you get a little bit more understanding of how to portray it correctly.
Well, it's just, I even had, I'm going to give some shout outs here to some people I'm having some conversations with that's so pertinent to this conversation. So, yesterday I had a meeting with Ryan from Sleep Apnea Leads. It's a company that helps dentists in the airway and sleep realm with marketing their practices and websites and getting connected with patients looking for the services they offer. And I said, gosh, it's just so different. Like with kids, we're just, we know that it's been an uphill battle for decades for adult CPAP alternatives, mandibular advancement devices slash oral appliance therapy, whatever you want to call it. Um, that has been decades long, and it's still a journey. Like, people are running to get Inspire, which costs tens of thousands of dollars, and it's a surgery, and it's not reversible, and it's like there's
And sometimes insurance doesn't pay for the battery to be changed out. You
yes,
have to
and
pay.
sometimes it doesn't work. And and it's needed. I'm not dismissing Inspire. My point is they're like rushing off to that when they could potentially try a device they snap in at night that basically holds the mandible, keeps that tongue from falling back, no surgery, covered by insurance, and it's so frustrating. I literally will get those patients because they went to an Inspire consultation and for whatever reason didn't qualify or it was too expensive. And then the doctor's like, well, there is another CPAP alternative. And it's just mind blowing to me that after decades, that's just not so just known that it's a CPAP alternative equal to CPAP if you're mild to moderate, or if you're CPAP intolerant severe, it is an option. It's frustrating because I've been doing that for 20 years. And here we are in this pediatric realm, which is blowing up and it's growing. Unfortunately, it's blowing up because so many kids are so sick. It's a pandemic. And it's like, how I'm talking to Ryan, and it's like, how do we get the information out? Because I explained exactly what you just said. I see every week parents driving from all over. They don't know what to do. They've been to two, some three ENTs. Some have had sleep studies. The sleep study came back normal, but their kid tosses, turns, breathes heavy, snores, but no apnea. So it was called normal, which that's still not normal sleep. They don't know what to do. The pediatricians and you and I bring up these professions not in a way to demonize them because they're not doing this. It's just frustrating. And we are trying to get, ASAP is trying to get an awareness, people collaborating, and my heart breaks for these parents because, like you said, here we are. We have all this information at our fingertips. We have courses at our fingertips. We have been educated in the language, right? We're speaking the same language. So we can at least decipher we can take the data and put together information. And even with that, because of our doctorate training and that and research, and we understand all that stuff, it's still hard and we're still fighting and we're still. So in your journey, you decide you're going to change the way you practice now because again, like you, I can't not help other kids. Everybody else's kids almost become my kids too. It's like I can't not help your children. So tell me how this journey transition to Breathe Cincinnati. I mean, isn't this a sleep only place? I don't think you're doing general dentistry there anymore. Okay.
No. So I don't do any restorative dentistry in my new practice. I will still see a little bit as an independent contractor for my other practice where I was at for 12 years. So the new practice, it started very small. It started one day a week inside of my old practice with the owner's permission because he really supported the efforts. He saw just the passion that was happening and he was just kind of like, yeah, I can clearly tell that this is where you're going to go. And he was very, very encouraging. Then it became I don't have enough room here. I don't want to do crowns. I don't want to look for cavities. I don't care anymore. I'm looking past the tooth. I think dentistry has been the whole tooth and nothing but the tooth for so long. And
And
I think,
and it didn't used to be that way. And
yeah,
you know what I mean? 100 years ago, it was more
no,
holistic, collaborative,
yes.
and we lost our way. Everything became compartmentalized. Agreed. The tooth,
Yeah.
the whole tooth, and nothing but the tooth. That's so good.
And I usually will say that I think it's been a disservice. We are trained from here to here, and the only way for me to know what I'm doing here and how it impacts the rest of the body is if there's someone who can look at the rest of the body and see all the changes. So imagine all the stuff that we're doing here to here, and then even micro focusing here to here. And we just don't know how it's impacting the rest of the body because we were never trained to look.
Hmm.
So that's where it was talking with physical therapists who are trained in myofascial release, talking to the chiropractors, talking to the osteopaths that do manipulation, because I think that originally osteopaths were very holistic in their approach. Um, and they have been fighting their own fight. The chiropractors have been fighting their own fight.
Yeah.
Um, and really just inviting them into my office and saying, look, I'm going to do this. Can you tell me what changes you see happening? And then they start sharing. We do this, we do that, we do this, and look at that change and that change. And you're just kind of like, I don't even know how to assimilate all that information, but I do, and I can now recognize that it's a multifactorial problem. And I just have this little piece of the puzzle. And if I think that my little piece is gonna work out for every single person that walks in the door, I'm gonna like be sorely mistaken. So I think I have felt the need to at least be aware of what other people are looking at
Yeah.
so that if it crosses my vision, I can say, hey, actually, I think you might need to go see this person first. Um, because I think that's where we get into trouble. Like, I think dentists, well, I'll speak for myself. I will not speak for the,
I have a feeling I know where you're going because I do think it's a culture in dentistry, but go ahead.
I think we like things black and white.
Hmm.
Like, we want to know what's right and what's wrong, and we want to make sure we're doing it right.
And we want
And
to
this is
fix
the
it
way,
and fix it,
yes,
just
and
fix
we're
it.
going to fix it. This is the way that I was trained. This is the way I'm going to do it. And the plan cannot be altered. But if the plan cannot be altered, then it's really not a good plan. It just, you need to be able to, think critically and consider more than just your zone. But what surprised me and what I would say to anybody that is listening, they are so receptive. So one of the first chiropractors that I went in to talk to, I said, "Hey, I know this is really weird because I'm just a dentist." So I try to take that out of my verbiage now.
Yeah,
Um,
don't say that anymore.
I know.
I
It's
almost
so
was like,
bad.
I want to
It's
just
so,
don't say
yeah. And
that.
I said, I'm seeing these things in the mouth, and I think they're impacting the body. And then I showed him some of my anecdotal evidence, my case, and he said, that's so interesting. He's like, I go into the mouth, I do things in the mouth as a chiropractor, some gentle manipulation, whatnot. But who else would bring this to the table if not the dentist? He's like, because we don't know the mouth. He's like, so you shouldn't come at it from that perspective of, I know I'm just a dentist. He's like, because it'll never come to the forefront unless the dentist brings it to the forefront.
Yeah, it's
Because
not
well,
just, it's like, I am a dentist and you can't do what I can do. We
yeah,
don't
I
have
think
it.
I would generally say that the physician population at large, I
Yeah,
kind of feel like the second class citizen
right.
of
Well, they'll
that.
say, we're the doctor. It's like, no,
Yes.
we're both doctors. You're a physician. I'm a basically oral physician, but it's just changing because it wasn't looked at like that back in the day. It's just, I don't know. The culture is interesting, and I think it's hurting more people than helping by having these, we don't speak the same languages and we're not communicating, we're not collaborating. Even within medicine, they have their hierarchy of who they think's the better, specialty. And I mean, it's like even in dentistry that happens,
Oh,
right?
absolutely. So it
So,
was looking for a lot of courses and spending a lot of money.
hmm,
Um,
a lot of time.
a lot of money. I would say at this juncture, I've spent more money on continuing education for airway than I did on dental school. But I went to dental school quite a while ago, so
Yeah, it's still
price
expensive.
isn't as expensive as it is now. But ASAP, 100%. The coursework is so vetted and it's so practically applied if this is the journey that you want to take. The, the verbiage that all three founders, the verbiage of all the speakers, it's like taking a full year residency and distilling it down and giving you a community in which you can feel confident in moving forward. Because even if obviously when you first try something, you're not going to be the best at it, or you're going to kind of fuddle through it. And that's where you rely on your patient relationship. Like if the patient really understands, you're trying your absolute best. Like this is as current as you can be. And if something falls a little bit funny, then you have a community to reach out to, and you have all of these, I mean, the accessibility through the chats. That is, I think, because it wasn't here in Cincinnati. There's a saying in Cincinnati that I don't think anybody in Cincinnati would disagree with, that don't worry if the world ends, because if it does, it won't end for another 10 years in Cincinnati. Because we're so slow to move. We're so slow. We're so conservative. And it was like, at first, it was, I'm just going to hide. I'm going to hide under the radar. I just want to help the people who want my help. I'm going to be very transparent. They're going to know that they're the first person. But then you have this group that gives you access to people who have gone ahead of you, who have pioneered, who have learned to have the thick skin. And then the fulfilling part of the changes that you have with your patients, gives you enough to keep going because it is hard. It is a totally different paradigm for
Yes.
my practice. Like I have a very specific, I am not your primary care dentist. Like if I see a problem, obviously I'm going to call it out, but that is not what you come here for. You are going right back to your primary care dentist. I am looking at the size and shape of the mouth. I'm looking for craniofacial development. I'm looking for neurocognitive impairments and trying to help get you to the right places because it will take 20 years before this is common practice.
Yeah.
Because it's taken 20 years just to get on the radar with oral
Yes.
appliance therapy. You're going to
Yes.
miss an entire generation. And no parent wants that. And so if you help the parent connect the dots, like I'm not trying to force anything, just saying if these are our goals and this is how it is. And I think even because the most recent course that I went to was Dr. Courtney Levine's, which was an amazing, amazing
And
course.
hers is the early ortho intervention course.
Yes.
And she is
Yeah.
she's an ASAP member and she's also an orthodontist. And what I love about Courtney, for those guys listening, go back and listen to one of the podcasts that she was on. But she had a very successful restorative practice as a primary care dentist and was like like you can't unsee what you've experienced or and she said, you know what, I'm going to go ahead and go back. And she became an
I
orthodontist.
mean, what a sacrifice. But the fact that she did that, it opens up the understanding. So I feel like we as primary care dentists, we have to flip the script. There is a superpower associated with seeing the entire lifespan. And I think that's why we're at the forefront of leading the charge.
Oh, say this again.
I
Hold on, Una, back it up. This I gotta tag Steve Carsonson in this too, because what you just said is amazing. Because he's the one that I learned the word primary care dentist from. And I know he's working with the American Dental Association and he is making big changes. Um, and we're so grateful for him and all the hard work. But you just said, I want to flip the script because you hear the word general dentist, like, and we have to be careful that we don't minimize our own profession just because the culture kind of has for some reason over the last few decades. But say it again, what you were saying, there is a superpower in seeing
yeah.
the entire lifespan. And I think that's what people aren't understanding. We got pediatric dentists here, and we're like, we want them to jump in. We want them to be more proactive and screen and refer. I mean, good grief, the amount of kids they see in a day, right? Then you've got your, orthodontists will see here, and the oral surgeons see everybody after they're done growing, and okay, we can't do anything but surgery at this point. So we just have this bird's eye view of a whole lifespan. Keep going with that. Beautiful. Well said.
No, I think that comes from my own journey of trying to hide and just like, I'm just gonna, but as a general or as a primary care dentist, because I think that is probably a better way because I do think that pediatricians, they are also treating from 0 to 18, but they're also micro focused because they don't see how those kids develop. So the primary care dentist has this lifespan following that can see a child from infancy through retirement. And then you start to see the fallout of what happens when the face doesn't develop properly. And then all of a sudden you go back home, you're in the chair and you're like, wow, everybody that has like this really good relationship with me because they're constantly coming in, they don't want to be constantly coming in. They all have these really small mouths. And the people that have their wisdom teeth, that have no cavities, that love coming to the dentist and have a relationship with a hygienist, they have no problems. Their teeth are wearing differently. And and it needs to be fully connected with the health of the body. And so recently I was clued into a book by Dr. Fonder, who references Dr. Price, and it's an out of print book, but it's called The Dentist Physician. and it was first printed out in 1977. And he had 35 years of anecdotal case reports of all of these different conditions and how when he treated inside of the mouth, these were the things that he saw. And he was proclaiming back then, we have got to stop this. Like we need to be merged together. The dental stress that is seen is stressed from the entire body. So I wonder, I'm sure that like ophthalmologists see the eyes as a window into the body and everybody sees that part. Um, but we were just protecting teeth and lining them up,
Yes.
at whatever cost.
Yeah.
That was what everybody's been conditioned to. That was the treatment that I received. It was standard of care. Any orthodontist that looks at my profile would be like, that looks good. I don't know, why you're doing what you're doing. Until I looked back at my life, I looked at my anatomy, and I saw all the compensations that were done to make you look appropriate. Um, and it was just like, no, I don't want to fight that anymore. I want the structural improvements. I want to be able to breathe. And everything about my journey has been so enlightening. I am actually a total CPAP advocate because I'm on a CPAP. I've been on a CPAP since I was 42. I self-referred to the sleep physician because no physician would look at me and think you might have obstructive sleep apnea. Um, I tried a mandibular advancement device. It was technically curative. I went to 0 apneic events. But that physician was very keen and he said, your scores, you're still reporting that you're tired. And I'm like, I'm better, but I'm not refreshed in the morning. And then he looked at the strip charts and he said, oh, you actually have no flow. Like this has nothing to do with your tongue. And I said, well, that's why I brought in the CT scan. Like it's like my tissues are touching. Like people don't know how I'm breathing during the day. And he said, well, then in that case, let's try the CPAP. And I thought, as a research, like let's try it. I've never
Yeah.
had it. Let's see what it's like. They put an elephant trunk on you, 27 leads. You're sleeping in what feels like a dirty hotel room. You've got cameras on you. And I slept 5 hours. The guy woke me up at 5 because he thought that I needed to be up at 5. And when I woke up, I was like, are you kidding me?
This is
This is
what
how other people wake up. Like for 42 years, I missed out on that. Like I could have been president.
think of what I could have done.
I mean, like dental school would have been so much easier. It wouldn't have been such a struggle. And so so I'm in a Marpy, which I guess we could have said that's why I have this beautiful lisp and I cannot say my own name. Um, but even the Marpy journey as a patient, when they first put it in, this would not happen for everyone. I was just kind of like, are you kidding me? Like it just comes in. You don't have to physically pull the air in. Like you don't have to like extend your whole body. The air just comes in because I had lost vertical dimension when they flared me out to compensate me. And so when I got just that little bit of vertical occlusion from the bands only and no plastic in my mouth, it was like you could see an airway on the CT scan when they did the post placement. And I was just like, you've got to be kidding. And now I'm at the point in my journey where there's enough room for my tongue. And I'm like, this is what it's supposed to feel like. You've got to be kidding me. It's just so nice because there's all these spots on the roof of your mouth that are calming and that are, when we look at the whole body, like when you
Absolutely.
don't have access to that, you use fingers, you use this, you use that. So that
There's
part is,
actually what you're referring to, and I think this is where you were going a little bit alluding to with that is, the tongue placement, that is why sucking and suckling is soothing. And the tongue should be pressing on the palate. And there are certain points that release certain chemicals in our body. And that is just factual. That is not like, that's not voodoo. That is actual just neurochemistry. And children that don't have their tongue in the roof of their mouth properly will put their thumb
yeah,
in and that's their pump to get that chemical to soothe. So
absolutely.
yes, yeah.
Yeah, they're all kids are gonna do what makes them feel good.
Yes.
So my son As soon as he was able to put his lovey over his head, every night at 18 months, always had it over. And I was like, what is that? And then an occupational therapist said, oh, he's harnessing, he's gathering carbon dioxide. He's increasing his carbon dioxide load so that he can have deeper breaths. He's she's like, it's kind of like when you're hyperventilating and they have you breathe into a bag. So like by covering it, you get to inhale what you just exhaled.
Creating a little bit because he was hyperventilating. So he was blowing off too much CO2. And then so now he can like have more CO2 that he's exhaled to breathe back in.
And it calms his body down
Yeah,
because
it
it's
is.
every single night. Nobody, like we never, but they figure things out. If I put my thumb in here and I push
I
here,
feel better.
better,
Yeah.
or this is why I have to do that. And then you're just like, oh gosh, just,
And that was an occupational therapist that figured that
yes.
out.
hmm
Now, let me ask you this about that occupational therapist. Did they have like what kind of airway background did they have to come to that conclusion?
Yes. So that occupational therapist is Sandy Prantle. She is also a craniosacral therapist. She has been practicing for like 40 years, and I don't know exactly, but maybe 10 or 20 years ago, she caught on to tongue ties, and it was like the missing piece for so many of her kiddos. And so she also has gone and looked at all these other professions and kind of started assimilating things in her own way to come up with a whole approach to that child. Yeah, so she was the one, and every time I take my kids somewhere, I'm just sitting there as a student. I want to absorb as much as you can give me because you know the body in such a completely opposite way from me.
Yeah.
Yeah, and I think that some of that comes from um, just the background that you have before you go to professional school. Because I was actually a musician. My undergrad degree is in music.
Wow.
And I was in an orchestra all the time. And I played the viola, which is like the most lackluster instrument of all the string instruments. They have a joke that if the viola's not there, you'll notice it. But if they are there, you don't hear it. So it's just kind of like, the joy is in the counterpart of everything. And you
Mm.
learn and you hear and you see and you try to connect the dots differently. So I think in terms of opening the practice, I went in with one thought that it was going to be kind of like this, but what I've learned to do is listen to the patients, and the patients have taught me so much,
Amen to
so
that. Amen to that.
and that's going to now continue to drive the direction that it goes in.
Well, we were talking about, it's so hard. Patients are trying to find this care. When I was talking to Ryan about marketing, it's like first you have to raise awareness that there is even a problem. Parents don't even know that, we've been marketing to adults for years. Do you have erectile dysfunction? Do you have high blood pressure? Do you have cholesterol issues? Do you have acid reflux? Are you exhausted? Are you a caffeine addict? Then you might have a sleeping problem. And not only that, it might relate to something a dentist can help with. I mean, that whole journey there, decades. And
Mhm.
there's raising awareness with the medical community. Well, now we've got this. How do we do this? It's like we have to first go to the parents, right? So we, as airway minded, airway and sleep specialists, we are going to social media. We're trying to educate our communities. Does your child wet the bed, toss and turn, sweat in their sleep? Do they have a diagnosis of ADHD or ADD? Are their legs moving a lot in their sleep? Do they have acid reflux? Are they snoring? Are they in the bottom third of their class? Are they small for their age? Failure to thrive. All of these things, did you know that could be related to their sleep? And then so there's that. Then there's this other piece of, did you know that the dentist is pretty much the forefront of triage of all of this? Um, they wouldn't think to even go to the dentist. So there's raising awareness that parents, your child's issues might be sleep related. I mean, that's a whole entity in itself
Yeah.
to understand and to market and to try to raise awareness, public service announcement, PSA. But then you have, do you know dentistry belongs in there? Because they're going to go, they hear this, then they go to the pediatrician that might dismiss them. Then they go to an ENT that might dismiss them. And they might even go to a dentist that dismisses them, or an orthodontist that dismisses them. So that's just like, how do you find the dentist that does understand the craniofacial respiratory complex, that understands that we have a seat at the table? Not only do we have a seat at the table, we're sitting in probably one of the biggest chairs at that table, because we see these patients more than any other healthcare provider. We see, the maxilla sits, the nose sits inside the maxilla, especially in a child. Like Stanley Liu has said, who is going to affect the flow of the nose? Who affects the
Yeah.
shape of the nose in a child? It's not the ENT. An ENT is not going to do surgery on a child's nose. It's it's the dentofacial orthopedist, whether you're an orthodontist, whether you're a dentist, whether you're a pediatric dentist. So, you're so brave, in doing what you've done. And I know it comes from, I really believe a lot of us doing this, it comes from the parent in us. And Susan Maples, I'm going to name drop Susan Maples. She's always said, when that child walks in your door of your practice, they're no longer somebody else's kid. They instantly become your responsibility as well. And once you see in your own child, it's like you just have such compassion for all these other parents out there. Um, Dave McCarty, he is an amazing sleep physician, very progressive, out of Colorado. And for those of you who haven't heard his, oh my gosh, his podcast, Empowered Sleep Apnea, it is amazing. It is a journey. And he too, like you, is a musician and extremely creative. But we talked the other day, and he said, Stacy, and he sent me a cartoon that he drew. He's an amazing artist. And it is amazing what he drew, but it's also very sad. And it made me realize just kind of how far we still have yet to go. But it's this giant cartoon with all these different organizations. You got otolaryngologists, you got the American Association of Orthodontists, you've got AADSM, American Academy of Dental Sleep Medicine. You have pediatricians and pediatric dentists and all these different silos and all the different facets that they control. And just how much communication just needs to happen in this cartoon. And I'm looking at it going, gosh, these are what these parents are up against. It's what we were up against. It's what we're still up against. So I guess for the listener right now, Una, the person listening right now, maybe the person's a parent and they're just, I don't know what to do. We always say, you can go to the ASAP pathway, look for a provider, and at least start the conversation there and have a consultation. There are other communities that are starting to do this and have provider lists so parents have somewhere to go to talk to. But if you're a practitioner listening, like a dentist, you and I have said this, we're both diplomates with the ABDSM, American Board of Dental Sleep Medicine, which is definitely geared more towards adult therapies. They are in the last year or two starting to have, people like Audrey Yoon come speak, and there's still a long way to go there, because the focus is definitely more mandibular advancement devices, and which is needed. It is needed. It is a CPAP alternative that is needed. But I find, do you talk to a lot of adult dental sleep medicine practitioners? Do you ever rub shoulders in that world much?
I do, in the sense that I want to have that availability to send a patient there if that's what they're looking for. I do them in my practice, but we are fee for service. So I want to give access to, if that's not within that patient's means. And then the getting that diplomate status was more to engage with the physicians, because that was really all that they know. And it was to make sure that I understood from, one of the older organizations, the viewpoint, the procedures, and I do hold myself to that standard in the sense that
Yes.
you have to have the sleep physician consultation. I will require a script. Like you have to, like I'm not going to manage your medical problem from my chair. Like that needs to be handled by the sleep physician. Because I don't want to think that I treated you correctly and that it is actually a disservice, because there are some people that there are other things going on.
Yes.
So I think it's really important, generally speaking, that if you're going to try and interact, on that level, if you want the seat at the table, you need to like understand the
You have to
lingo and
speak the language.
perspective
That
and
is what, yes.
why they stand the way that they do, because then you have a better appreciation of how you can engage with them. I think, going back to little comments that I've heard, because as a primary, I couldn't understand why are they not doing this? Why are they not doing this? Why are they not doing this? And then you talk with them with an open mind and they give you a little tidbit of, well, this is why that doesn't. And I'm like, oh, okay. Now I understand so much more about your profession. And one of those light bulb moments was an orthodontist when I was at a course out in Seattle who was sitting next to me, and she's like, "Are you a general dentist?" I'm like, "Uh-huh." And she goes, "So you pay to come to these courses and you sit here for like 8 hours for like 2.5 days?" I'm like, "Yeah." And she goes, "Oh, like we don't do that." And I was like, "Oh, what do you do?" She said, "I'm an orthodontist." And I'm like, "Okay." And then so I was, she said, orthodontists, we're happy people. We have open chairs. We don't like crying anything, and if I present this type of treatment plan, oftentimes that parent is just going to go down the street to the next orthodontist and get a shorter plan, a cheaper plan, and they're just going to go with that because I don't have the time to sit there and discuss all of this. She's like, if they come to me for an airway reason and they open that door, then okay, that's a different story. And that's where I realized I will bridge that gap because the restorative dentists with the business model that they have and the hygiene checks and the running the columns, they don't have time to do that. But if they're aware and they can send someone somewhere, they
Yes.
probably would because they care. And the orthodontist also wants to do that, but they have a certain business model and it's not equipped to handle those type of in-depth conversations. And that's where I was like, that's where Breathe Cincinnati sits. Because I'm gonna take the patient, I'm gonna educate them, and I'm gonna get them where they need to go. And then all of us collectively will have helped that person if we communicate. I'm not taking anything away from anybody else. I just want them to know what options are available. And the mouths are getting so small and the posterior crowding and my kids are included in that, like not really having enough room for their second molars in the same way that we lost room for our wisdom
With
teeth.
our wisdom teeth, I'm seeing so many impacted second molars.
Yes. I'm
Yeah.
like, so, but not to be afraid about talking about surgery, not that it has to happen now, but not eliminating that choice. So for me, I'm undoing all the orthodontics that was done when I was in junior high because my mom had lower jaw surgery. Had I not gone through ortho that way, I could have probably just had lower jaw surgery. But because no parent wants surgery, they did what they did to make me look fine. They gave me a smaller mouth because I was a small mouth. I was always had my mouth open. And now I have to undo all of that and then move forward with double jaw surgery in June, hopefully. So like, we can still treat the kid ideally and leave that option on the table. But if you're too afraid to have the conversation because you think the parents are going to get scared, most of the time the parent's going to see themselves in the child and say, I don't want them to have the same.
That's
That's
right.
me.
That's
I don't
right.
want my daughter to struggle that much if she goes to college, and
Right.
potentially suffer from depression, anxiety, all of those things because the body is screaming like, it's just so foundational to everything. So, but I wanted to circle back. The community, I don't think that I could have done. And it was actually my office manager who was a previous patient who said, I like showed ASAP and I was like, this is kind of expensive, but look at everything. And she said, Well, I don't think you have a choice because that seems like your tribe.
That's so
Like that,
interesting. That seems like your try, which is like,
yeah.
yeah,
Those are the people who are on the same journey. I'm not someone that has thick skin, but going and meeting all of the people on the same path that are all charging forward to make this happen for the community at large, it gives you a sense of one relief, like, oh, there are other people like me. I'm not alone.
yeah, yeah.
Two, like it gives me a sounding board of these are all the problems that I've had. And then three, you guys have cut through all of the verbiage. Like you got to hit that at the front. You have to be able to tell them what they're going to hear at the pediatrician. Give them all the things they're going to hear in advance because it will give you credibility that you know what you're talking about. But you have to hit it from the front. And so that I think is wholly why I was able to have the confidence to open up this practice. I can say that like
Oh,
with clarity.
that
Like,
which warms my heart and makes me happy because, like you, this is the whole reason ASAP even exists is because we were like, not only do mom and dads, do parents, right, have to fight so hard to get this information. Michelle Tracy and I were like, dentists have to fight so hard to get this information. How can we look? Yeah, it's not like, this isn't like a weekend course and this is a journey. It's a pathway. That's why we named it Pathway. It's not a one and done. We're constantly learning and updating, but the point was, we spent tons of money. Just if you add up what the three of us did, it's like this is insanity. And then we developed analysis paralysis. Well, what do I start with and what do I use? And gosh, how confused are dentists when they take all these courses? So how do we remove the noise? And, again, every dentist is different. What kind of device works in their hands, what they're comfortable doing. Some people do MARPE, some people do MARPE and RPE, some people just do slow expansion, some people do Invisalign only in the little, some people don't do any of it, but they triage. There's a place for everybody to help kids in this community. But, you know, if you look at for us, we were like, like you said, there is a price point, right? But it's like, how much more did I spend and how much more time did I spend flying everywhere frantically trying to help my kids? And that's why we formed ASAP. So it warms my heart as a colleague of yours to hear you say that it's helped breathe Cincinnati. It's helped you,
oh,
help more people because that is literally, there's days I'm like, oh my gosh, I'm so tired.
it has to be utterly exhausting for all three of you. But again, to me, my office manager, to her credit, she's like, I don't understand the problem. She's like, they are females. They are also have that mothering instinct that's in them, and they are forging the way. Because if you look at all the other dental platforms out there, that's not the picture that you see.
What
You
is
know,
what's the picture? I'm curious, like,
what's the picture?
yeah, what
I
do you
usually
see?
see. I usually see lots of men teaching, and I've seen some women in the past who have tried to teach who are excellent, and they just get pushed out because they are just not understood. I see a certain demographic, but that is all changing. And even when it comes to something like menopause, I'm like, oh my goodness, do you know why this is a topic? It's because there are finally women who
Yes.
are of age that are going through it. It's
Yes.
no longer men telling us what's going on in our body. I mean, our bodies are so complicated that they don't even want to study them. Like, oh, we can't do this. That we have to do the studies in the male body because we don't have to deal with cycles. There's all these extra organs, like.
Yeah, so
And
what
so,
they did, Una, is they just said, let's study men.
yep.
And then what we'll do is just make women miniature men and give them less dosage, which is not at all how we're not just like children, right? Let's take kids and just make them miniature adults.
Yeah.
That's not how it works either. Yeah. You got
And
to
it's funny because I've been to courses where a gentleman has come up to me and he goes, "Hey, did you notice that it's like 90% female?" And I was like, "Oh gosh, I didn't even pick up on that." He's like, "I find that so interesting because he was an older gentleman." And I said, "Oh, well, I can tell you why." He goes, "Why?" I said, "Because we're here for our kids. Like we want to help our kids." And no, nothing against the men, but like they don't necessarily, the male dentist doesn't necessarily know how they're, I don't know. I don't want to put shade there at all, but just that there's this instinct and this gut feeling. And so for the parent that's listening, I would say your gut is right.
Oh, I said this to a mom last week. I had a impromptu phone call. A friend of mine, Dr. Anne-Marie Morse, she is a neurologist, brilliant. I'll throw her in there, damn good sleep, DAMM. She's phenomenal. Anyway, she said, "Hey, will you talk to this mom for me? She's phenomenal. She's great. I met her at a narcolepsy event. She's got issues with her kids." And again, here's the story. I went here, I had an ALF, and then I had an expander, and then I've had that, and I'm tired. So anyway, I mean, back to what you're saying, I said to her, "You're talking to me because your intuition is telling you you're missing something." And she said, "Yes." I said, "Your into a mother's intuition is it's a superpower."
Yeah, and I love I had a screenshot from somebody that went to one of the ASAP courses before I went, and it said something like a
Nobody does
mother
better
better
research than a
research.
worried
Yeah,
mother. Though a worried mother does better research than the FBI. And that's my
100%.
It's so true.
100%. Like she sent that snapshot and I was like, yes.
Yes.
Um,
Yeah,
their intuition, and I always tell my patients and their parents, if this sits well with you, then move forward. If it doesn't sit well with you, it's not the right thing.
absolutely.
Trust yourself. Like just because I'm noticing this, it doesn't actually mean anything.
100%. I mean, and again, like you said, and I love what you said that you're the bridge. And I feel the same way in my community. None of us are here. There's plenty of bread and butter orthodontics to do, the social six, make teeth look pretty. And there's plenty of patients if that's all they want and that's all they need.
Yes.
But there is an entire population of children and adults that have craniofacial respiratory complex issues. And we are obligated, and the American Dental Association is really pushing the front on this, and I love it, that we should be asking the questions um, of sleep and snoring and airway health because it's our zone. And for those of you not watching this, I'm like going from the top of my head to like where my clavicles are, like this is the area. And that's why the ENT and the dentist do really well collaboratively is our zones overlap each other and we need each other. And I tell my patients, I cannot, there are certain things that my treatment or who I would refer you to, their treatment will help maybe bring that soft palate a little more forward, maybe make the airway a little bigger, maybe make the nasal volume a little bigger. But I need that ENT, and that ENT needs us. So we're going to work together as a team to help you and
Mhm.
communicate with your other physicians as well. But, I that's why it's like, I read an article once that an orthodontist put, and it was really, I mean, Mike DeLuke, he sent me the article. He goes, "This is just disheartening to even hear this orthodontist." He was like, "I don't understand why everybody's talking about airway. If you wanted to talk about airway and sleep, you should have gone to med school." But that's somebody that's sticking their head in the sand that has a model in their practice of get them in, get them out, quick, quick, quick. He doesn't want to change. That's fine. Then don't. But do not condemn people
Mhm.
or insult or demonize or criticize people that are looking. I mean, this is our area, The palate is the base of the nose. The nose sits in the middle of that maxilla. Like everything overlaps. And if you think us looking at that is out of scope, I don't know. Maybe he should have gone to school to just like whiten teeth or something. I don't know. Like I don't know why he's an orthodontist. I'm just like,
Well,
what
you know,
what are you doing?
the funny thing is, when I first started and I was looking for an ENT, I found an osteopath. He was the only ENT that was still solo in the city of Cincinnati. He was the only private practice ENT. And I scheduled an appointment with him, and he said to me, "You know what's funny?" He's like, "When I first moved to Cincinnati, he's like, I went to so many dentists, and none of them wanted to work with me." But and he just retired like a year ago. So this is like 40 years prior
Hmm.
that he felt like I should be really be working with the dentist. And nobody ever reached out to him. And I was the first dentist at the end of his career coming to him to ask him to collaborate. And it was just funny. You should have seen the shock in his eyes, just like, gosh, it's like
Like,
full
where have
circle.
you been for the last 40 years? Is probably what he's thinking. Like, and it's interesting because, I've had Alan Reisinger on. He is amazing. He spoke at the American Dental Association primary care, or I'm sorry, cardiology connection, just like he works with MDVIP, basically dentists working with cardiologists. And, they literally, this group will guarantee you will never have a heart attack on their watch. That's a
Wow.
pretty profound,
That is a
or we will give you your money back.
wow.
These are physicians. Why do they say that? Because their cardiologists have to work with dentists.
Hmm.
And when you incorporate the oral systemic connection, they know when you have scaling and root planing, it changes the inflammatory markers. It changes all of that. It changes. So they know that they can lower the chance of heart attack and other issues when they work with the dentist. When they do not, they cannot guarantee you won't have a heart attack. Just I'm telling you, it didn't used to be this way. And I mean, like, I can sit and talk to you forever, because this is like, again, you're my people. And there's so many of us out there. And I'm sure somebody's listening to this right now, like driving or whatever, like, yes, this is what I'm going through too. And how do we make a difference? And because it needs to happen. We need to get back to the way things were. I actually had a medical doctor tell me once, it's interesting. It used to be that medical doctors, when they were in med school, they had to work with dentists decades ago. They had to understand what the dentist did so that they could refer appropriately. And I'm like, that is just not even on the radar right now. And it needs to be like, when should you refer to your dentist? And even in or in dental school, like the culture doesn't nurture a lot of collaboration with medical doctors and how to communicate well. And so I'm just so proud of you and I'm proud of what you're doing. And I'll have to have you on for a part two in your journey because it sounds like you're getting ready to go into another possible, surgery coming up and everything and how you're doing with that. But even the growth of Breathe Cincinnati. Um, Michelle and I were talking this morning. She said there's some exciting things that you're looking at with ties and releases. And she's like, I know you don't, we won't talk about that necessarily today, but you've got some interesting stuff that you're seeing whole body wise, and research is coming, things are coming, but just even the power of talking about what's anecdotally going on in our practices, it is powerful. And that is how research happens is and a group of people seeing commonalities doing the same things and saying, hey, we're seeing patterns.
Mhm.
These patterns need to be discussed and researched,
Yeah.
so, and you only do that if we all communicate and we all talk about it, instead of, oh, that's just anecdotal. Well, how does any research happen? We see
Yeah.
things anecdotally, like Viagra was like, hey, is anybody else seeing this happen? This little pill? Well, we should study it, like now look at it. I mean, geez. Um, well, I absolutely just, you're amazing, fantastic. I'm happy to know you. I'm just, you're doing amazing things on this planet, helping so many people. And I appreciate you giving us your time today. I gotta wrap up with three random questions here, Una, and then I would love to have you back on. And I'll have how people can reach you. I think your Instagram handle is at Breathe Cincinnati, correct?
Yes.
And then what's your website?
ReadCincinnati.com.
All right, that's pretty easy. I'll put all that in the description in the podcast too. So here we go. Question number one. What food do you absolutely hate?
Oh, escargot.
Ooh, I've never had that.
I
That,
know I haven't, but I don't think I ever will either. That's the
oh,
only thing I
okay.
don't think I could ever eat.
Yeah, you know what's funny? So for people that don't know what escargot is, it's snails. I was in a health food store. I think it was Whole Foods, a Whole Foods store, and I was going to the freezer section, and I saw a box of. So I'm like, I knew I was in a different part of town than where I live because we don't have escargot in the freezer section where I live, right? We have toasted ravioli. But anyway, so I saw that and I thought, who looks at
Who
that and
buys
goes,
that? I don't know.
mmm. But I'm sure somebody's listening and they're like, they're delicious. You're missing out. But I
Yes,
can't. Ooh.
probably correct. Yes.
Oh, okay, I'm with you on that. Okay. Um, are you a dessert or savory kind of girl?
Hmm.
I mean,
I think savory because I will always get a bag of chips to eat late at night.
yeah, bag of chips, like some salsa or something like that with it,
Yeah.
a little dip.
Yeah. Yeah.
Oh,
But I love a good ice cream, but probably still savory.
yeah, I'm with you on that. And then if you had a surprise day off, like you wake up and someone says, all your patients are canceled, like you got a surprise day off, what are you going to do on your surprise day off?
Oh, it depends on if my kids are with me or if I'm free of my kids.
All right, let's do just Una.
Just me.
It's a Una day.
I would just sit in my house and enjoy the peace and quiet and then sit in the sun. Just
Mm,
that's all I would want. Feet in the ground, butt on the ground, in the sun, reading a book. Yeah, that just at home in the quiet, that would be
sounds
wonderful.
beautiful. It sounds beautiful. Grounded, sunshine, all the things of wellness. Yeah. Soothes your soul. Well, I appreciate you, Una. Keep going, girl. You're
Yeah,
doing
no, thanks.
amazing things. And I was going to talk about too, we do have some courses with ASAP coming up. We have a MARPE clinical update December 16th. It's on a Tuesday and it's virtual and it's led by the one and only Ilya Lipkin. So we got that coming up. And we also have our course finally out this week, our 2026 mini residency pathway, 4 courses next year. Very comprehensive for anybody that wants
My
to.
plug for that would just be you got to meet the other people that are in the group so that you know who the people are that are chiming in on the chats. I think that's you can study all the online stuff, you can get all that stuff, but like if you want to be there and get to like rub shoulders and you will get so much like sustenance from that will carry you through
There's
the
energy there. There's an energy with meeting people in person, getting to know the people behind the group chat names,
yes.
and a camaraderie. And I'll go as far as, to say a love for each other, and I will say the community for me, I mean, I'm learning every day from you guys. I learn all the time. Selfishly, I love ASAP because I'm like, I get to learn too. And um, there's so much there. So I appreciate you being here, and I'm so glad ASAP has helped you, and you're helping us too. And we just appreciate you so much. Thanks for being here today, Euna.
You.
And
Bye.
thank you, listener, and we'll see you next time.
Bye.
Bye. This podcast would not be possible without the inspiration of my dad, Daniel Becker, and creative direction and editing from the very talented Jason and Dane Becker, Ben, Lydia, and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And please remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice or to replace your healthcare provider's diagnosis or recommendations.